So these products that I have in front of me aren't necessarily to improve sleep quality, though sometimes I do use them in this case. But these products are designed to strengthen your jaw. And you might say, why do we want to strengthen our jaw? Well, oftentimes, if you're having jaw pain, you're having headaches, eating different foods or chewing can exacerbate those conditions. And what patients may not realize over time, because it's their jaw and it's not like their knee, is that they are deconditioning those muscles, which then contributes to the problem. We have pain, we stop eating, therefore we go to a more softer diet, those muscles atrophy, then when we try to return back, we have more pain, we continue. So these are products that I use with my patients that have had a bunch of dental work, that have chronic TMJ pain or headaches, that we can help re-strengthen their jaw to help them get back to normal eating. There are two different types of products here, and there's a variety of things that you can find out there. But why I pick this brand specifically is because it has different levels of resistance. A lot of the products might just be a standalone product, which I find for my patients could be too much or could be too little, and it gets a little harder to dose, just like any other exercise. The product right here is a full guard, so you can put that in your entire mouth and you can just chomp down on it. Usually, I encourage my patients to kind of chew like they're chewing a piece of steak. Hold for a second, relax. Hold for a second, relax. When we eat a meal, research shows we're chewing about 200 to 300 bites. So the dosage on this type of exercise is usually 3 sets of 30 or 3 sets of 40 reps. The downside to this product specifically is that you have to have a bit of jaw range of motion to fit this in your mouth. So for a lot of my patients, this is a little too hard to start with. The other downside is that you are using both sides at once. You cannot just chew on one side. And there are cases where people have dental work on one side and they have been chewing more on the opposite side for a period of time. And we're really just trying to bring the one side more up to speed. So in that case, I use this product right here. You get 2 chewers in each, and there are a variety of resistances. There are actually even resistances beyond this, but these are the colors I start with because the green even can be too much for some of my more chronic patients. With these products, you have options. So you can put both in at the same time if you want to work both sides, or you can put one in. I typically have patients put this where they put food, so not all the way in the back, not all the way in the front, somewhere in the middle, kind of where you would be eating your slice of bread or whatever you're eating. Same kind of dosage. You'll just start with repetitions, and then you can work your way up into reps, or you can work your way up into resistance levels.